Hi everyone, I'm Dr. Faisel Syed.
And I'm Dr. Dan McCarter.
And you're listening to Faisel Friends, where we believe access to primary care is a right, not a privilege.
Today, I'm talking with Dr. Sachil Shah about disruptive cardiology care. Let's dive right in. I'm Dr. Dan McCarter. I'm always here, but Dr. Syed is on vacation this week, a well-deserved vacation. I think of the movie with Chevy Chase driving around in an RV, which is what Dr. Syed's doing. So I think it would be more fun to be with Faisel than with Chevy Chase. I'm joined by Dr. Sachil Shah, who's a regional medical director for cardiology. And Dr. Shah, really, this is a podcast where we're talking to residents and medical students and other people interested in value-based care. So we really like to get the stories of our guests. So what led you to medicine and what led you to cardiology?
Well, thank you so much, Dr. McCarter, for inviting me here. I really appreciate the time. Great question. What got me into medicine? So as with many people, it isn't just one thing. It's multiple things that happened over my formative years and as I progressed in my early schooling. I think there are three distinct scenarios.
Okay, so first, just to set the stage, where were you growing up, and where was your early schooling?
Okay, fair enough. So if I went even further back, so I grew up in England. I was actually born in Africa, and my parents emigrated to the UK when I was very young. So essentially, I grew up in England, and I was fortunate enough to have a great upbringing in terms of schooling, education. And as I said, there were two or three events early in my life that really made me think that medicine was the career for me. First off, which is a very early memory of mine, is when I was on a flight. I can't remember where it was, but someone collapsed in the airplane, and a doctor of some sort jumped up, helped the person who seemed like was having some kind of arrest. I'm not sure exactly, but I was absolutely blown away by how calm he was, how he was able to handle the situation, and how he actually brought the person back. It was exhilarating and scary at the same time, but really made me kind of appreciate what they do. And I'm of the age where when I was younger, watched a lot of television, and ER, which was, I'm sure, a very famous program here, but it was equally famous in the UK. And I would watch that diligently, and really appreciate their stories. And I know most of it was more action than reality, but still there were components of it which really resonated with me. Not only the science, but also the ability to care for people. And then finally, I had a lot of friends that were doctors, family friends, and I spent time with them. And all of that really made me feel that medicine was a career for me. I was analytical. I loved science. I loved chemistry, physics, and mathematics. But I was also a people person, very social, was part of a community. And I feel that medicine is the best combination of both the science and analytical side of a career, as well as the social side of it. And it really, is a great balance.
Great. So, I think that's a great example of seeing people be of service and make a difference. Although I've got to say, I'm getting ready to take a flight the day after tomorrow, and I certainly hope I don't wind up being that doctor. So, just saying that's an issue there. But so, where did you do your medical school and your residency?
Sure. So initially, I did my training in the UK. I went to the University of Birmingham, which is in central England, and I did my medical school there. I did a bachelor's of medicine as well as a bachelor's of science together as a combined double degree, and then I continued into residency and actually did a GP training program or a family medicine training program. So I was a GP in England, general practitioner, for a number of years before I decided to make the leap across the pond to move to the US to pursue a career in cardiology. And so it was a big effort, as a lot of immigrant doctors know and understand, doing the US exams as well as retraining. I landed not too far from where I am now, which is in Miami. I ended up doing a residency in West Palm Beach as part of the University of Miami. I did that for 3 years. I was fortunate to match in cardiology at Georgetown University in Washington, D.C. So I did 3 years in Washington, D.C., which was a fantastic experience, hard work, but really it gave me the thrill of being a cardiologist, understand the role that we play. And then what ended up happening is I did 1 year of private practice in cardiology, and then after that 1 year I arrived at Chen, and that transition, when I realized what it was like to be a cardiologist in the legacy fee-for-service industry, that opened my eyes to a lot of things. And then serendipitously, Chen Med arrived, or we came together, and I am where I am now.
And that is such a great story. Um, and I just wonder, how much do you think your training and your work as a GP in England led you to the interest in value-based care? And I've got to say, I know in this country, family doctors want to be considered a specialist, and GP can be a pejorative term here, but I think I think in the UK that they're very highly respected, and they provide a lot of care for the patient. So what do you think that experience as a GP? What did that bring to you as a cardiologist now? And then how did that impact your decision to look for a different way of practicing?
A great question. So I was heavily influenced. So if I answer the first part of your question, correct. GP, general practitioners, are very well regarded in the UK. In fact, I believe that the primary care services in the UK are world class and the gold standard of how primary care should be delivered in the world. And I say that because every single patient has to have a primary care physician, and primary care physicians are the managers of their care. They are unable to see any specialist without having seen a primary care physician or the primary care physician having made a referral. So they truly are the organizers. And the motto for the NHS, the National Health Service, is from cradle to grave, and the GPs really exemplify that. You are the first port of call. You make the decisions about what's appropriate, what's not. You are always thinking about making sure that you provide value-based care. And then if you make a decision with the patient that further services are needed, then the referral is made, a consultation is placed. And I love that aspect of it, because it made it, you were not only, you would take a holistic approach to patient care, which is social, psychological, and involve the patients in their decision before involving any other specialist. And I really appreciated it from that point of view. I loved cardiology as I was a GP, and I really wanted to pursue a cardiology career after general practice. One, because I loved cardiology, and two, it really allowed me to explore other areas of interest, including surgeries, procedures, medicine. And so it was the next logical step for me. But that's where the differentiation ends. I think that the training for specialty care in the UK isn't as high quality as it is in the US. And so that's when I made that jump.